And then there is instructions on how to do that right here. If you have any trouble doing this, please call our office. That is what we are here for, to help you through this. And I think if Sandy or Kim or Johnny is on the call, like, we will be on site. I think that's the plan for next week, maybe at a couple different places. I don't know that we exactly know what sites we'll be at, unless one of you guys wants to jump in. Are we going to kind of play it by ear?
Yeah, we were going to kind of play it by ear and see, you know, how our employees did with setting this up, and kind of maybe visit the areas where we may have had the most trouble or the most need, let's just say. So, sorry about that. We are definitely planning on a couple of different areas. That way we can spread them out a little bit, you know, so it's not as much travel. Maybe one at St. Elmo and one at spread that out if needed to. So if we could do that.
Okay. Make sure to send that out ahead of, you know, the RuralMed team, or it'll come from Ease, just like we sent out the one face-to-face. I think the date we're talking about being on site is the 18th. If you weren't done by that day, we probably would require you guys to come sit down with us and do a face-to-face. So we'll keep moving on with choosing the plans here. So like I said, you guys are going to have 3 HSA plans to choose from, and then the PPO. So if you were to select one of the HSA plans, we would continue. And it's not doing it right this second, but it will in a minute, and I will show you. You are going to be able to enroll in what's called a health savings account. So if you enroll in one of the first 3 plans, you will be able to enroll in a health savings account. If you're doing this, this is to put money away pre-tax for medical needs, you know, to pay a copay, to pick up a prescription, to pay for glasses, let's say. You must set that up with your bank, or a bank that will allow you to set up an HSA. We will put instructions in there on kind of the verbiage that you can take to your bank. Some banks, I think most banks do it. Some banks won't, but a lot of local hometown banks do, they may charge a little bit of a fee, but if you already do your checking or savings through there, a lot of times they waive that. But yes, we will make sure to help you guys through that if that's something you're interested in doing. And then it's gonna, after the HSA, which I can go back to that in a minute here, but after the HSA, it will bring up your dental plan. So again, the dental is moving. Right now, you guys have United Healthcare for dental and vision, and it's moving over to Blue Cross Blue Shield. So you are going to get a new dental card in the mail, just not a vision card. And we'll go over what you say when you go to the eye doctor here in just a second. But as you can see, if you look over here to the right, if you have a full family, it's going to show you what that costs per paycheck. If you want to just see that, or if you're employee only, here's your cost, and it adds it all up here at the end. Same thing with the dental plan, just like the other one. It's not as, beefed up here, but it'll give you the dental summary here and show you, your benefits here. And then the vision, it's going to work just the same. The pricing will change over there on the right, and you can add or delete people. Now, if you don't already, I should make it clear too, for any of the coverage, if you don't already have a dependent on and you want to add them, now's the time to do that. Or you want to take them off, now's the time to do that. This is your annual enrollment, so you are able to make changes like that without a qualifying event. So as you can see, like I said, over here on the right, these prices will change, and then the new total will come up here. And if you scroll down, you'll also see the plan summary. The biggest thing with Blue Cross Blue Shield Vision, like I said, you're not going to receive a vision card, but when you go to the doctor, you're going to tell them that you have iMed through Blue Cross Blue Shield, and then they're just going to want the last 4 of your social or your date of birth, and they'll be able to look you up. That's for anyone on your plan. So if you do have a spouse or children on your plan, they will need your information to do that. So they'll say IMED and then the last 4 of your social or your date of birth. This all does go into effect March 1st. I should mention that as well. Okay, here we go with the health savings. So if you select the health savings, one of the first 3 plans, they're marked HSA, that does qualify you to add an annual contribution amount depending on if you have an employee only or a family enrolled. If you have an employee and a spouse or employee child or employee family, you can contribute up to $8,550 annually. That's the maximum set by the federal government. If you are, and it will spell all of this out too, but if you are employee only, it will be $4,300 for the year. So let's just say that you would rather go by pay period and just say, okay, I want to put $10 in a health savings account. Again, that's pre-tax, so it's a tax benefit. And I want to put $10 per paycheck. It will do the calculation for you and show you annually you'll be putting $260 away. That does go typically when you go to the bank and set that up. You will then need to get that banking information to your payroll department to let them know where to put that $10 a paycheck, just so they know where that is to go. Something new this year for you guys is what's called Teladoc. So Teladoc is a virtual general medicine. It's an app on your phone. It is one of my favorite products that we offer. I use it. Everyone in our office has it and uses it. It saves so much time and money. So for $6 a paycheck, and that covers either employee only or employee family, it doesn't matter how many of you are enrolled. You can, in minutes, get on the phone with a doctor virtually and do a telemedicine appointment. So you'll sit in a virtual waiting room for, I don't know, 3 to 5 minutes maybe, for things like a sore throat, ear infection, pink eye, poison ivy, anything minor like that that can be kind of detected over the phone. Or let's say one kid has strep throat and now you have it, or now the other kiddo has it. And usually when you call in with something like that and you explain a situation to the doctor, they're going to be like, okay, well, that makes sense. Here's some amoxicillin. You then use your Blue Cross card to go to whatever pharmacy and pick that prescription up. You do not have to be on the medical insurance through RuralMed to take advantage of Teladoc. Your spouse and your dependents, any of your dependents, do not have to be enrolled in RuralMed. If you're an employee only on the insurance, then you're able to enroll your entire family on the Teladoc, no problem. So there is so much more than just general medicine. I think one of the biggest things, oh, there is no copay. I did see that pop up, and I can't see the whole question, but I will have Aaron look at that. But that is a very good point, whoever just said that. The $6 is all you pay with Teladoc, the $6 per paycheck. If you do get a prescription, you'll have to pay for the prescription just as you would if a doctor prescribed it. But there is no copay, which is that's where you see the huge savings here. This can be another huge thing is mental health. So you're able to set up reoccurring appointments with a mental health provider. You can go through a plethora of mental health providers and choose, what is their specialty. It shows what they look like. It shows their bio, all of those things. So it is a really great benefit to be able to see that and then set up those reoccurring appointments, like I said. There's a lot of information here on setting up that app. If you were someone who was going to download the app, you can download it right now. Just know that they're not going to have your information until 3/1. So when you go to sign in, if you did it before 3/1, they wouldn't be able to detect who you were because we haven't given them your information yet. So just FYI on that. And then I will go back to I'm going to look in the chat box here in just a second, but I just want to show you guys the ending here, what it should look like. So if you were to sign up in a health savings account, it is going to have you do the beneficiary tab. Health savings account is kind of treated like life insurance. If something were to happen to you, this health savings account card does have money on it. So it does need to go to someone. So you would put, and you don't have to use whoever's in here. You can add a beneficiary and put whoever else you would like. but you do have to at least do a primary. It has to total 100. So you can do 50-50 and then continue. It just has to total the 100%. When you get to the end here, it's going to show you your summary of the plan you chose, who you're covering on all of these, and that it starts on 3/1. And then it's also going to show you the cost here. If everything looks good, you hit continue and then sign forms. And the first thing it's going to have you do is type your name in a box that shows up. So you type your name, hit next, and then you're going to put your beautiful signature there. And then in each of these green boxes, you're placing your signature, just saying that you waive or enroll in the coverage that we just talked about. Most important things to note is click finish signing like I just did, and then you have to click finish one more time, and then you're actually complete. You're off the, what we call the naughty list. But you would be able to then go back in and see any of the benefits by clicking over here on the left. Just want you to know that if you were to get to this screen after you went through and signed, if you were to click this button, it will save all of your elections, but it will force you to re-sign. It'll show you not finished, even if you've already been through and signed, if you click this button. So if you want to change your mind, no problem. But you do have to click, if you wanted to like see what you were already enrolled in, if you click over here, it won't change anything. So let me go over to the chat and see what we were saying. So I'm going to go to the top. Hopefully everyone's receiving their logins via email. If you haven't received it, please check your spam. If you still don't see it, contact our office. We'll be here to give you that information. So yes, if you're, I see someone ask, currently, let's say currently you have your wife covered, but your daughter loses her coverage in the middle of the year. Let's say she loses her coverage because she lost her job, or she switched jobs and they don't offer coverage, whatever that life event may be, that is a qualifying event. So throughout the year, yeah, open enrollment is the only time where you can come offer on the plan without a qualifying event. Loss of coverage is a qualifying event. So as long as that child was 25 or younger, then you're fine to put them on there. If we pay the $6 a month for Teladoc, do we still have to pay the copay? Nope. And I think that's the question that prompted me to say that. You pay the $6 per paycheck. So it ends up being $6 per pay, $13 a month. But then you get access to all of the care that I spoke about, and there is no copay associated with that. Yep, I see that Teladoc you cannot add anyone but spouse and children onto Teladoc. And it's $6. And it is $6 per paycheck for either you or your entire family. So it doesn't matter how many people you're covering, it's $6 per paycheck. And then if anyone has any questions and they want to come off mute.
James has his hand up.
Oh, okay, yeah. I'm not sure.
So I think you misunderstood my question.
Okay.
So me and my wife are currently covered under RuralMed's plan. My daughter is not. So if my daughter happens to lose her coverage throughout the year, can I take my wife off and add my daughter? Because I can't afford to have them both on there.
Oh, I see what you're asking. I don't believe you can add your daughter, but you would not be able to take your wife off.
Okay, thank you.
Yep, you're welcome. I'm sorry about that. Does anyone else have any questions? Or any trouble? Is anyone able to log in? Or hopefully, I mean, you can just raise your hand or wave or something if you're able to. Perfect. Okay, so someone said they logged in, so that's good. That's a good sign. It is very easy and user friendly, but like I said, we are here to help throughout the whole entire process. In the email that you received, our support emails there. We're in Peoria, Illinois, so we're not too far from you guys. But yeah, we're here to help. So if you guys have any issues throughout this process, please reach out. That's what we're here for. On top of that, we can help throughout the year. So if you ever have a claim issue, you need help finding an in-network doctor, a bill doesn't look right, anything like that, please contact our office. That's what we're here to help, not just through open enrollment, but throughout the year. I appreciate everyone hopping on the call. It looks like we have a lot of people on, so that's great. Does anyone have anything else? Or Kim, do you want to say anything? Or
No, this is about a quarter of our people. So we did have a good turnout, 31, let's just say 25 with your, excluding your staffers. So this is a good turnout. We're about a quarter of the way. So we have about 100 to 105 employees depending on the day, and things like that. So we are looking forward to those other dates for sure. I do want to remind everybody that this team is an excellent team. They are your go-to people for all of your benefit questions and things like that. Sandy and I are not the experts. This team is. That's why we have them working for us and working for you, because they are very good at their job. They will be able to answer any questions you have about any of our benefits. It looks like they just put their support email up there. Also, their contact information was sent out to you guys by email. Do keep that handy. We'll keep it handy at the office too in case you need it. But please utilize this. We're excited. Initially going into open enrollment, our past broker quoted us a near 27% increase for all benefits except for vision and dental. It was a little bit of a sock in the gut, let's just say, because I know we all work hard to keep our money. We all need to cover ourselves and our children. This agency worked very hard for RuralMed to get our benefits, near close to what we at least had before. So I would like to, thank these guys. They are working hard for us and working hard for you, so please use them, and we appreciate them.
thank you, Kim. That was very nice. We're really excited to work with you guys. And please reach out anytime. Also, one thing I wanted to note is that.
Oh, I'm sorry.
It's okay. Sorry, I was hearing myself talk. I lose my train of thought. All I'm going to say was, please make sure that you're logged in and complete this. And please correct me if I'm wrong, Kim or John, by the 19th, correct? We will be on site the 18th, but I think the 19th is the drop dead date that this has to be done by.
That's what we had in our notes.
Perfect. We are all on the same page then. All right, guys, thank you so much. I hope you have a safe day. Like in the chat box, please write down that phone number and email address and reach out to us as you go through the process if you have any questions. Thanks, you guys.
One thing, I think James Coons has his hand up for a question. Do you got time to answer that one?
Oh, yeah, of course. Yes.
She already answered it. I just forgot to lower my hand.
Oh,
Okay, all right. Thanks, James.
all right. Thank you, everyone.
All right.
Have a
thank
good
you,
day.
guys.
Uh-huh.